Question 1. An architect is covered under a disability policy with a 24-month own occupation definition, which then converts to an any occupation definition. After being disabled for 12 months, the architect takes a part-time job as a university lecturer. How will this affect the disability benefits? A. Benefits will be terminated immediately because the insured is gainfully employed. B. Benefits will be reduced by the amount earned from the lecturing job. C. Benefits will continue in full, as the insured is unable to perform the duties of their own occupation. D. The policy will immediately convert to the any occupation definition. Answer: C. Benefits will continue in full, as the insured is unable to perform the duties of their own occupation. Explanation: under an own occupation definition of disability, benefits are paid if the insured cannot perform the material and substantial duties of their specific job at the time of disability. The key here is the own occupation period is still active, as only 12 months of the 24-month period have passed, and the insured architect still cannot work as an architect. Earning income from an entirely different occupation during this specific period does not disqualify them from receiving full benefits. Always check the policy's definition of disability and its timeframes, as this is the most critical factor in determining benefit payments. Question 2. An individual health plan under the ACA has a $2,000 deductible, 20% coinsurance, and is designed to cover 80% of total average costs for a standard population. To which metal tier does this plan belong? Bronze. B. Silver. C. Gold. D. Platinum. Answer: C. Gold. Explanation: the ACA categorizes health plans into metal tiers based on their actuarial value, AV, which represents the average percentage of total medical costs the plan is expected to cover. A gold plan is defined as having an AV of approximately 80%, meaning the insurer covers 80% of costs while the insured covers the remaining 20% through cost sharing like deductibles and coinsurance. The other tiers are bronze, 60%, silver, 70%, and platinum, 90%. Just remember the sequence: the more precious the metal, the higher the percentage the plan pays. Question 3. A terminated employee has a qualifying event under COBRA. If the employee properly elects continuation coverage but fails to make their first premium payment within the 45-day initial grace period, what is the consequence? A. The employer must pay the premium on the employee's behalf. B. Coverage is retroactively terminated to the date of the last premium payment. C. The insurer must extend the grace period by an additional 30 days. D. The employee is granted a special enrollment period for an ACA marketplace plan. Answer: B. Coverage is retroactively terminated to the date of the last premium payment. Explanation: COBRA continuation is contingent on timely premium payments, and while the law provides a 45-day grace period for the first premium after election, failure to meet this deadline has a clear consequence. If the initial payment is not made, the insurer can retroactively terminate coverage back to the end of the last period for which a premium was paid, meaning the individual never truly had the continuation coverage. This protects the insurer from covering claims for a period where no premium was ever received. Think of it like a subscription. If you don't make the first payment, your access is cut off from the moment your previous paid-up period ended. Question 4. An employee pays for their individual disability income policy with after-tax dollars. Later, the employee becomes disabled and begins receiving a monthly benefit of $3,000. How are these benefit payments taxed? A. The benefits are fully taxable as ordinary income. B. The benefits are partially taxable, based on the ratio of premiums paid to benefits received. C. The benefits are received entirely income tax-free. D. The benefits are taxed only after the total amount received exceeds the premiums paid. Answer: C. The benefits are received entirely income tax-free. Explanation: the tax treatment of disability income benefits is determined by who paid the premiums and with what kind of money, pre-tax or after-tax. When an individual pays the premiums for their own policy using their own after-tax dollars, any benefits received are not subject to income tax. This is a significant advantage of personally owned disability insurance compared to most employer-paid plans where premiums are paid with pre-tax dollars. An easy way to remember this is, if you pay with after-tax money, the benefits come back to you tax-free. Question 5. An HMO contracts with a group of physicians and pays them a set monthly fee for each member assigned to them, regardless of the number or type of services performed. This payment arrangement is known as fee-for-service, B. Capitation, C. Usual, customary, and reasonable UCR, D. Prospective Payment System PPS. Answer B. Capitation. Explanation. Capitation is a payment model where physicians and medical groups are paid a fixed amount per patient, per capita, or per head, over a specific period, regardless of how many services that patient uses. This model is a hallmark of many HMOs, as it shifts some financial risk to the provider and encourages a focus on preventive care to keep patients healthy and costs down. It stands in direct contrast to the traditional fee-for-service model, where providers are paid for each individual service they perform. You can think of capitation as a subscription fee. The HMO pays the doctor for each patient they agree to care for. Question 6. A health insurance policy includes a time limit on certain defenses provision. 2.5 years after the policy is issued, the insurer discovers the insured made a material misrepresentation on the application that was not fraudulent. What action can the insurer take? A. The insurer can void the policy and refund all premiums paid. B. The insurer can reform the policy to reflect the correct information and adjust the premium. C. The insurer can deny a claim related to the misrepresentation but cannot void the policy. D. The insurer can take no action because the 2-year contestability period has passed. Answer D. The insurer can take no action because the 2-year contestability period has passed. Explanation. The time limit on certain defenses provision, often called the incontestable clause in health policies, prevents an insurer from voiding a policy or denying a claim based on a non-fraudulent misstatement after a certain period, typically 2 years from the policy issue date. Since the discovery was made after the 2-year period and the misrepresentation was not fraudulent, the contestable period has expired. The only exception to this rule is for fraudulent misstatements, which can allow an insurer to contest the policy at any time. The key takeaway is that after 2 years, innocent mistakes on an application are locked in. Question 7. An individual has an accidental death and dismemberment (AD&D) policy with a principal sum of $100,000. The insured is in a severe accident and permanently loses sight in one eye and severs one foot. According to most standard AD&D policies, what is the maximum benefit payable? $50,000. B. $75,000. C. $100,000. D. $150,000. Answer C. $100,000. Explanation. In an AD&D policy, the principal sum is paid for accidental death, while a percentage of that sum is paid for specific dismemberment losses. However, policies typically consider the loss of 2 or more members, a hand, foot, or sight in one eye, to be a catastrophic event that triggers payment of the full principal sum. Since the insured suffered 2 qualifying losses, sight in one eye and a foot, the policy would pay 100% of the principal sum, which is $100,000. Always look for the loss of 2 or more limbs or senses, as this often qualifies for the maximum dismemberment benefit, equal to the amount paid for accidental death. Question 8. A patient is hospitalized for surgery. While the patient is still in the hospital, a representative from the insurance company monitors the length of stay and the services provided to ensure they are medically necessary and appropriate. This cost containment measure is known as pre-certification. B. Concurrent review. C. Retrospective review. D. Prospective review. Answer B. Concurrent review. Explanation. Concurrent review is a utilization management technique where the insurer monitors a hospital stay while the patient is still admitted to ensure that the services are appropriate and medically necessary. The keyword clue here is while the patient is still in the hospital, indicating an ongoing or concurrent evaluation of care. This is different from prospective review, like pre-certification, which happens before treatment, and retrospective review, which happens after treatment is complete. It is a way for insurers to manage costs in real time during an expensive hospital admission. Question 9. An individual is eligible for Medicare at age 65 but continues to work for a company with 50 employees and is covered by the group health plan. At age 67, the individual retires. Which of the following is true regarding their enrollment in Medicare Part B? A. They must wait until the next general enrollment period and will incur a lifetime late enrollment penalty. B. They can enroll in Part B through a special enrollment period with no late enrollment penalty. C. They are ineligible for Part B because they declined it at age 65. D. They can enroll immediately but must pay 2 years of retroactive premiums. Answer: B. They can enroll in Part B through a special enrollment period with no late enrollment penalty. Explanation: a special enrollment period, SEP, is granted to individuals who delayed Part B enrollment because they had active group health coverage through their own or a spouse's current employment, from an employer with 20 or more employees. This SEP allows them to enroll in Part B within 8 months of the employment or group coverage ending without facing a late enrollment penalty. The size of the employer is a crucial detail, as it makes the group plan the primary payer over Medicare. Remember, having credible group coverage from current employment is the key that unlocks the penalty-free special enrollment period. Question 10. A policyholder's long-term care policy is triggered when a physician certifies they are unable to perform 2 of 6 activities of daily living (ADLs). After receiving benefits for 6 months, they recover the ability to perform one of the ADLs and are now only unable to perform one. What is the most likely outcome? The benefits will be reduced by 50%. B. The benefits will continue as long as the insured is unable to perform at least one ADL. C. The benefits will terminate because the insured no longer meets the policy's benefit trigger. D. The benefits will continue for a contractually specified recovery period before terminating. Answer: C. The benefits will terminate because the insured no longer meets the policy's benefit trigger. Explanation: long-term care benefits are contingent upon meeting the specific triggers defined in the policy, such as being unable to perform a certain number of ADLs. The question states the trigger is the inability to perform 2 ADLs. Once the insured recovers and can perform 5 of the 6, they no longer meet this definition of a chronically ill individual. Therefore, the insurer will cease paying benefits because the qualifying condition is no longer met. Think of the benefit trigger like a key to a lock. If you no longer have the full key meeting the 2 ADL requirement, the benefit lock will not open. Question 11. An insurer uses experience rating to determine the premium for a large employer's group health plan. Which factor would be the most important in this calculation? A. The average age and gender mix of the employees in the group. B. The overall health statistics of the community where the business is located. C. The specific claims history of this particular employee group. D. The number of dependents enrolled compared to the number of employees. Answer: C. The specific claims history of this particular employee group. Explanation: experience rating is an underwriting method used for large groups where the premium is based on the actual claims experience of that specific group in the recent past. An insurer analyzes the group's historical data, how many claims were filed and how much they cost, to predict future costs and set the premium accordingly. This method contrasts with community rating, often used for small groups and individuals, where the premium is based on the overall risk profile of the entire community. For experience rating, the group's own track record is the number one factor. Question 12. A child is covered under health plans from both parents, who are married and live together. The father's birthday is May 10th, and the mother's birthday is March 30th. According to the standard birthday rule for coordination of benefits, which parent's plan is considered primary? A. The father's plan is primary. B. The mother's plan is primary. C. The plan of the parent whose policy has been in effect longer is primary. D. The parents can choose which plan will be primary for each claim. Answer: B. The mother's plan is primary. Explanation: the birthday rule is a standard provision used to determine the primary insurance plan when a dependent is covered by both parents' policies. The rule states that the plan of the parent whose birthday occurs earlier in the calendar year, month and day only, is the primary payer, and the other parent's plan is secondary. Since the mother's birthday in March comes before the father's birthday in May, her plan is primary. It is an easy rule to get confused, so always focus on which birthday comes first on the calendar, ignoring the year of birth completely. Question 13. To be considered fully insured for Social Security Disability Income, SSDI, benefits, A worker must have accumulated a total of how many quarters of coverage over their working life? 6 quarters of coverage earned at any time. B. 20 quarters of coverage in the last 10 years. C. 40 quarters of coverage. D. 1 quarter of coverage for each calendar year after age 21. Answer: C. 40 quarters of coverage. Explanation: to qualify for SSDI benefits, a worker must meet both a recent work test and a duration of work test to be considered disability insured. The primary duration test for being fully insured requires a worker to have earned at least 40 quarters of coverage, equivalent to about 10 years of work, over their lifetime. The other options refer to different requirements, like the recent work test or rules for younger workers. However, the core requirement for being fully insured for Social Security benefits is the accumulation of 40 credits in total. Question 14. An insurer plans to obtain an investigative consumer report on an applicant for disability insurance. According to the Fair Credit Reporting Act (FCRA), what must the insurer do first? Obtain the applicant's medical records from the MIB. B. Inform the applicant in writing about the report within 3 days of requesting it. C. Request the report and provide a copy to the applicant only if coverage is denied. D. Send a copy of the application to the applicant's employer. Answer B. Inform the applicant in writing about the report within 3 days of requesting it. Explanation: the Fair Credit Reporting Act places strict requirements on insurers when they use consumer reports, especially an investigative consumer report which involves interviews with associates, friends, and neighbors. The law mandates that the insurer must provide a written disclosure to the consumer that such a report may be obtained, and this disclosure must be given no later than 3 days after the date the report was first requested. This rule ensures transparency and gives the consumer awareness that their personal life is being investigated for insurance purposes. Think of it as a mandatory heads-up to the applicant before the investigation begins. Question 15. A law firm purchases a business overhead expense (BOE) disability policy on its partners. One of the partners becomes totally disabled. Which of the following expenses would be covered by the BOE policy? A. The disabled partner's salary. B. The cost of hiring a temporary replacement for the disabled partner. C. The firm's monthly office rent and employee salaries. D. Lost profits resulting from the partner's absence. Answer: C. The firm's monthly office rent and employee salaries. Explanation: a business overhead expense policy is designed to cover the ongoing, normal business expenses necessary to keep the company running if a business owner becomes disabled. Covered expenses include items like office rent, utilities, leased equipment costs, and the salaries of non-owner employees. The policy specifically excludes the disabled owner's own salary or lost profits, as these are meant to be covered by other policies like individual disability income insurance. The purpose of BOE is simply to keep the lights on and the doors open until the owner can return to work. Question 16. A 30-year-old purchases a disability income policy with a guaranteed insurability rider. At age 35, their income has significantly increased. What does this rider allow the insured to do? Exchange their any occupation policy for an own occupation policy without proving insurability. B. Increase the policy's monthly benefit amount at specified dates without providing proof of insurability. C. Convert the disability policy into a permanent life insurance policy without a medical exam. D. Receive a refund of all premiums paid if they have not filed a claim by age 65. Answer B. Increase the policy's monthly benefit amount at specified dates without providing proof of insurability. Explanation: a guaranteed insurability rider, also known as a future increase option, on a disability policy gives the policyholder the right to purchase additional amounts of coverage at predetermined future dates or upon certain life events. This can be done without having to provide evidence of good health, which is the key benefit. This rider is valuable for younger professionals whose income is expected to grow, as it protects their future earning potential from the risk of becoming uninsurable due to a new health condition. They will have to provide financial justification for the increase, but no medical underwriting is required. Question 17. An applicant for a health insurance policy has a significant medical history that they failed to disclose. The underwriter checks the MIB Medical Information Bureau. What information will the underwriter find in the MIB report? A. A detailed copy of the applicant's medical records from their physician. B. A statement from the previous insurer on why coverage was declined. C. Codes representing certain medical conditions or hazardous activities found during previous underwriting. D. The applicant's credit score and financial history. Answer: C. Codes representing certain medical conditions or hazardous activities found during previous underwriting. Explanation: the MIB is a non-profit information exchange for member life and health insurance companies, designed to prevent fraud and concealment during underwriting. It does not store detailed medical records or underwriting decisions like denied. Instead, it holds high-level, coded information about medical impairments or hazardous activities an applicant may have disclosed on a previous application, which alerts the underwriter to a potential discrepancy. This coded report prompts the underwriter to investigate further, for instance, by requesting an attending physician's statement. Question 18. Under HIPAA regulations, which of the following is a permitted disclosure of protected health information (PHI) that can be made without an individual's specific authorization? To a marketing company for a new drug trial. B. To a prospective employer for a pre-employment screening. C. For treatment, payment, and healthcare operations. D. To a family member who is not involved in the patient's care. Answer: C. For treatment, payment, and healthcare operations. Explanation: HIPAA's privacy rule strictly governs the use and disclosure of PHI but provides specific exceptions to ensure the healthcare system can function. The most common permitted disclosure is for TPO, treatment, payment, and healthcare operations. This allows a hospital to share a patient's information with another specialist for a treatment consultation or with an insurance company to process a claim for payment, all without needing separate authorization for each instance. Disclosures for marketing or to employers almost always require specific patient consent, so remember TPO as the core, authorized reason for sharing health data behind the scenes. Question 19. An individual is turning 65 and has enrolled in Medicare Parts A and B. During their 6-month Medigap open enrollment period, they apply for a Medicare Supplement Plan G. Which of the following is true regarding the insurer's underwriting? A. The insurer can deny coverage based on the applicant's pre-existing health conditions. B. The insurer must issue the policy on a guaranteed issue basis without medical underwriting. C. The insurer can charge a higher premium based on the applicant's health status. D. The insurer can impose a 12-month waiting period for pre-existing conditions. Answer: B. The insurer must issue the policy on a guaranteed issue basis without medical underwriting. Explanation: the 6-month Medigap open enrollment period is a one-time, federally protected window that begins on the first day of the month an individual is both 65 or older and enrolled in Medicare Part B. During this specific period, insurance companies are prohibited from using medical underwriting. They cannot deny a policy, charge more, or impose waiting periods due to the applicant's health history. This guaranteed issue right ensures that all new Medicare beneficiaries have access to supplemental coverage regardless of their pre-existing conditions. Missing this crucial window can make it much harder and more expensive to get a Medigap policy later. Question 20. A dental plan covers cleanings at 100%, fillings at 80%, and crowns at 50%. The plan has a $50 annual deductible that does not apply to preventive services. A member has a cleaning, $100, a filling, $200, and a crown, $1,000, in their first visit of the year. How much will the member have to pay? $590. B. $640. C. $670. D. $1,300. Answer: A. $590. Explanation: the total member responsibility must be calculated step by step based on the plan's cost-sharing rules. First, the $100 cleaning is a preventive service covered at 100% with the deductible waived, so the member pays $0 for it. For the other services, the member must first pay the $50 annual deductible. After the deductible, the member pays 20% of the $200 filling cost, $40, and 50% of the $1,000 crown cost, $500. Therefore, the total out-of-pocket cost is the $50 deductible plus $40 coinsurance for the filling plus $500 coinsurance for the crown, which equals $590. Always remember to apply the deductible first to non-preventive services before calculating the coinsurance amounts. Question 21. A major medical policy requires the insured and the insurer to share covered losses in a 20/80 split after the deductible is met. This provision is known as stop-loss, B. Coinsurance, C. Copayment, D. Maximum out-of-pocket. Answer B. Coinsurance. Explanation. Coinsurance is the percentage of costs of a covered health care service that an insured person is required to pay after they have met their deductible. It is expressed as a percentage split, such as 20/80, where the insured pays 20% and the insurer pays 80% of the covered charges. This cost-sharing feature is different from a copayment, which is a fixed dollar amount for a specific service, and a stop-loss, which is the total dollar amount limit on what the insured has to pay in a policy year. Remember that coinsurance is always about a percentage split of the bill. Question 22. An individual has a qualified long-term care partnership program policy with a total benefit of $200,000. They exhaust the full benefits of the policy for their nursing home care. When they later apply for Medicaid, how will their personal assets be treated? A. They must spend down all assets to the normal Medicaid eligibility level. B. $200,000 of their assets will be disregarded for Medicaid eligibility purposes. C. They will be automatically eligible for Medicaid regardless of their asset level. D. Their home will be protected, but all liquid assets must be spent down. Answer B. $200,000 of their assets will be disregarded for Medicaid eligibility purposes. Explanation. The primary benefit of a qualified LTC partnership program is asset disregard, which links a private LTC policy with Medicaid protection. Under this program, for every dollar the LTC policy pays out in benefits, a dollar of the policyholder's assets is protected from the normal Medicaid spend-down requirements. Since the policy paid out $200,000, that same amount of the individual's assets will be disregarded when determining their Medicaid eligibility, allowing them to qualify for Medicaid while retaining more of their savings. This creates a powerful incentive for people to plan ahead with private LTC insurance. Question 23. A vision insurance plan covers one eye exam and one pair of corrective lenses per year and specifies that it will pay up to a maximum of $150 for frames. A member chooses frames that cost $225. How is the cost of the frames typically handled? A. The plan will not cover any portion of the cost because the frames exceeded the allowance. B. The member pays the full $225 and is reimbursed $150 by the insurer later. C. The plan pays the first $150, and the member is responsible for the remaining $75 balance. D. The member pays a 20% coinsurance on the entire cost of the frames. Answer C. The plan pays the first $150, and the member is responsible for the remaining $75 balance. Explanation. Vision insurance plans often operate on a schedule of benefits or allowances rather than using deductibles and coinsurance for hardware like frames and lenses. The plan specifies a frame allowance, which is the maximum dollar amount the insurer will pay for that item. If the member selects frames that cost more than this allowance, the insurer pays its maximum, $150, and the member is responsible for paying the difference, $75, directly to the provider. This is a very common structure for benefits like frames, so it's important to understand the concept of a fixed allowance versus other forms of cost sharing. Question 24. A health insurance claim is submitted with a diagnostic code of J45.909, unspecified ASM A, and a procedure code of 99214, office visit. Which coding system is used to identify the medical services and procedures performed by the physician? A. International Classification of Diseases ICD. B. Current Procedural Terminology CPT. C. Healthcare Common Procedure Coding System HCPCS. D. Diagnostic and Statistical Manual of Mental Disorders DSM. Answer B. Current Procedural Terminology CPT. Explanation. In medical billing, two main coding systems are used: ICD codes for diagnoses and CPT codes for procedures. The question asks to identify the system for the services and procedures performed, which corresponds to CPT. CPT codes, like the 5-digit code 99214, are used to describe medical, surgical, and diagnostic services rendered by healthcare providers. In contrast, ICD codes, like J45.909, are used to represent the patient's diagnosis, answering the question of why the service was needed. Question 25. Which of the following is true regarding a health reimbursement arrangement, HRA? A. It is funded solely by employee pre-tax contributions. B. Employees can carry over unused funds from year to year, as determined by the employer's plan design. C. The HRA must be offered in conjunction with a high-deductible health plan, HDHP. D. Employees own the account and can take it with them when they leave the company. Answer B. Employees can carry over unused funds from year to year, as determined by the employer's plan design. Explanation. A health reimbursement arrangement, HRA, is an employer-funded account that reimburses employees tax-free for qualified medical expenses, and it is entirely at the employer's discretion whether to allow unused funds to roll over. Unlike health savings accounts, HSAs, HRAs are owned and funded exclusively by the employer, so the funds are not portable if the employee leaves. While some HRAs are designed to be paired with high-deductible plans, it is not a universal requirement for all types of HRAs. The key distinction to remember is that HRAs are employer-owned, employer-funded, and employer-designed.